the first question is, the predictive model you showed in your final slides were so interesting. And were there any demographic modifier, gender, age, etc., that also factor into the predictive model?
Thanks, Amanda, for asking the question. One of the things two things. So we did look at age and gender. Unfortunately, we didn't have access to much of the other demographic information available for these particular analyses. But in terms of age and gender, yes, they were considered in the model. And what I didn't show in the development of those models, we looked at 3 types of models. One was using all the variables, so all the covariates, including age and gender. One was using no covariates, and then another one was this more discrete set, which was informed by a set of experts. And those covariates were what provided the model, what led to the best performing model. And so in these particular models, age and gender weren't a particularly important factor in these predictive models. And that's not to say that it's not important, but at least for this particular outcome, yeah, those things weren't relevant or not as relevant as some of the other key indicators. But I mean, I would like in future studies, looking at a wider range of demographic variables is definitely something we're interested in doing, because there's things to do with disadvantage and so on that may be relevant for these types of models.
Right, and then the second question, how can post-secondary stakeholders, that is the staff, the faculty, how can they use what was presented today in their own practices?
Yeah, that's great. So, I mean, hopefully I was trying to, as I mentioned, our work isn't, we are doing more and more with universities in terms of the Inner World platform that was developed for workplaces and universities. But I think there's still many key messages you can take away from this work, because as I've mentioned, the services we work with are largely based, they're literally on campus at the University of Sydney. So they get a lot of young people coming to those services with mental health problems who are engaged in university. And so I think some of the key messages include the importance of personalization and measurement-based care, and that a multidimensional approach, which I can't stress enough, because the outcomes are varied and they're dynamic and changeable over time by various factors that might be going on in someone's life. So understanding and measuring these over time is really critical, especially when someone's in university or work in university setting where, as I sort of showed on the first slide, disengagement from university during this time in someone's life can have really, significant consequences later in life. It's sort of, it's a really critical period. So being able to really measure how someone is tracking and making sure they're engaged is really important. Using, and I think technology is really a key way we can do this, alongside someone's engagement with university studies. How are they engaging? What other things might be going on in their lives, so that early interventions and preventative strategies can be implemented at a much earlier point. And the other key message here is, trying to use smarter tools, leveraging things like machine learning to identify groups who might be at risk in the future. And so, as I sort of showed at the end of the talk, we could identify, and we can start to identify who among a group of people might be at risk of these poor outcomes, and putting the supports in place earlier on for these young people who during their studies and so on, so that we can maybe prevent or delay any types of impacts on their functioning. And similarly, and the other final 2 points I'll make is about demand management. I'm sure university settings is no different to many services where, high demand. We have a huge international student population here at the University of Sydney where there are quite significant mental health concerns. And so, being able to, again, try and try and stratify and provide people with the right level of support early on is really critical. And again, technology can support us in trying to identify these people early, but then, don't sort of set and forget, then use measurement over time to see how someone's progressing and adjust supports accordingly. And then finally, the final point is about generally in terms of the research methodologies. I'm sure everyone knows, working in this space knows the importance of co-design and those types of things. But the really critical thing I'll make about our sort of implementation research is about changes to clinical process, which again is no different in the university setting. I'm sure, it's challenging and trying to understand people's individual beliefs and their sort of concerns about changes to clinical processes, and trying to ensure that these are done in a very collaborative and in a way that consults and brings people along for the journey is really important, rather than just implementing a change and expecting everyone to adopt it.
Right. There's a question from myself. So as I'm a researcher in this kind of wearable device, are your platform only like, is it just a platform, or you're also using some kind of wearable trackers, like mobile phone trackers, actigraphy, things like this?
Yeah, so we that we are engaging in that work more and more now, and so we don't see this just being limited to things like self-report and online. We definitely see the importance of engaging, and I think wearables are really critical in the future. Maybe not for everyone, if everyone wants to engage in it, fine. But I think coming back to those individual groups at risk, monitoring people using wearables, which is much more frequent and much more comprehensive monitoring during critical periods. So maybe, you might do it for groups at risk or during really critical periods of the university year, for example. I think wearables can really be quite important for those groups to try and prevent maybe further progression or poorer outcomes. And we are also using actigraphy, which is we use a much more advanced sort of sleep watch, which is different to sort of the usual Fitbits and the phone. And again, we give that to groups that we think are at risk, to try and identify early markers of sleep and circadian disturbances, which may give us an idea about who might be at risk for things like bipolar disorder or atypical depression and other things. So yeah, I think that's the value of technology, is being able to bring together multiple sources of information about a person to try and personalize care as much as we can, and tailor it to an individual scenario. So I think wearables plays a really critical role in providing that personalization.
Right. Thank you, Dr. Iorfino. So I think this is a wonderful talk, and several questions are very informative, very inspiring as well. So I think this will conclude the Q&A session, and I'm going to hand it off to Christine.
I actually have a question too.
Okay.
I guess as being one of the hosts, I can turn my video on to ask. In terms of adoption of technology and measurement-based care, we've been going through this. As you know, you were recently in Toronto visiting us a couple of weeks ago. You showed a slide about adaptation. So I think there's a adaptation to technology, and there's adaptation to measurement-based care. In terms of your experience, especially with the site that's on the University of Sydney campus of origin, is there any advice, suggestion, or have you guys written anything about that, especially with, as it relates to both staff as well as students or patients, participants, clients?
Yeah, so I mean, we have there was a slide. Oh no, I took that slide out. There is a paper from which is led by Hayley LaMonica, which really sums up a lot of the work that we've done in terms of implementation and the barriers and some of the strategies we've used to do that. And there are things like, leadership and again, some of the things I've mentioned about, those engagement strategies. But we've got a paper that's under review at the moment, which is about the polarization and the uncertainty. And in that, I think that work there really pointed out, I mean, it sort of sounds obvious and might seem trivial, but the really importance of top-down and bottom-up approaches to implementation. So, the bottom-up thing is really important because what we found was the impact of individual clinician, their own views and attitudes towards not only technology, but as you said, measurement-based care. What is their view in general of providing care, and how that is the modifier or to their then engagement of these new practices. So I think trying to understand what are people's underlying beliefs and attitudes is really critical, so that you can maybe tailor your implementation to certain groups. Because some people in the services we've worked with will not need much support at all to adopt, versus there are groups that do need much more because it does maybe challenge their existing practices or their existing attitudes towards practice. And so it's quite a jump for them to then do something different in terms of these new approaches. And the top down is really important too, because those changes to clinical process won't happen unless there's that leadership and there's that push from a policy and a service management point of view. And often, I mean, a lot of this is not just about clinicians, but it's about the other staff in the service as well, admins and other support workers who are really critical to trying to engage people with the technology. And we're embarking much more now on using digital navigators. So these are peer support workers, young people with experience often, who are there to try and facilitate engagement with the service, working with the young people to improve the data input and improve measurement in general, because it's a vicious cycle that we've found. So young people tell us that they don't use the technologies because the clinician doesn't use it. And then clinicians tell us that they don't use it because young people don't use it. So there's this vicious cycle that needs to be broken from both angles, I think. Hopefully that answers your question.
It does, and I'll look for the papers, and also very interested in the digital navigation. So we'll connect about that as well.
Yeah.
So, I think people, at least in North America, will be happy if we end a few minutes early because it's dinner time here. So I'll just wrap up if that's okay, and I don't see any more questions. So thank you, Dr. Iorfino and Dr. Guu, for being here today. Really interesting talk.